Hello everyone, I am Dr. Shekhar Ganju, a dermatologist practicing in New Delhi, and I welcome you all to my YouTube channel. And if you've not already subscribed to the channel, please subscribe, hit the bell icon so that you can get the notifications directly of the new videos that we put up. Before we begin, I want to tell you that we are in this journey learning together, so I read up stuff, I present it to you, and you also get to know new things. So the topic of interest today is the topically applied vitamin C serum, and the reason why I have chosen this topic today is because not a single day passes in the OPD when I am not asked about the vitamin C topically applied serum. So patients would ask me which brand should we choose, what concentration of the vitamin C should we apply, should we apply it in the morning time or at the night time, what quantity should we use, what disorders should we use it for. So it's a question that is very commonly asked in the OPDs, and I'm sure it must have crossed your mind at one point of time or the other. As is common with our videos, before exploring about any topic, we usually understand the molecule in detail. So understanding the vitamin C becomes paramount for us. There have been numerous studies that have been done to prove the efficacy of vitamin C. But an important aspect to remember is that the vitamin C that we orally ingest in our diets, a very small percentage of that actually comes to the skin. So some of you might now think that let's ingest a 10 times more quantity so that 10 times more would come to the skin. So if you're trying to do that, you should be aware of the side effects or the adverse effects that may come with excess quantity of vitamin C if you ingest it. So patients may experience nausea, vomiting, diarrhea, and also kidney stones if they take a supra-normal doses of vitamin C. The recommended dietary allowance for vitamin C is about 100 milligrams per day. So this brief discussion tells us that the topically applied vitamin C is essential because a very small quantity of the orally ingested vitamin C actually comes to the skin. So moving ahead to the next part of the discussion, how does vitamin C help? The vitamin C acts in three ways. First, by acting as an antioxidant. So we have all the oxidative stresses around us, something like the pollution, something like the sunlight. If somebody is smoking around us, which is known as passive smoking, that also acts as an oxidant stress. So vitamin C acts by neutralizing the reactive oxygen species which are produced as a result of the pollution, as a result of the sunlight-induced UV damage, as a result of passive smoking around us. So it neutralizes all the reactive oxygen species which these processes produce. Also, we have seen that the topically applied vitamin C enhances the efficacy of the sunscreen. Mind you, it does not act as a sunscreen by itself, but enhances the efficacy of a sunscreen by neutralizing the ultraviolet induced sun damage. The second mechanism by which the topically applied vitamin C acts is by boosting collagen production. This it does by acting as a cofactor for two enzymes. One is lysyl hydroxylase and the other one is prolyl hydroxylase. These are the enzymes that help in cross-linking of the collagen, and hence it gives us a healthy collagen which is produced. The topically applied vitamin C also inhibits matrix metalloproteinases which are involved in the collagen degradation. Hence, by inhibiting the collagen degradation, it adds on to the collagen which is formed. Is by coupling with a metal known as copper. Now we all know that copper is involved in melanin production. So by inhibiting or coupling with this copper, it lessens the amount of copper which is needed for melanin production, as a result of which it evens out the skin tone. So the next question that should naturally pop out in your mind is when I should be using the vitamin C serum. Should I be applying it in the morning? Should I be applying it at night? I would suggest, and in my clinical practice I have seen the best results come when you apply the vitamin C serum in the morning time. The added advantage of that is it neutralizes the ultraviolet induced sun damage, the free radicals, the reactive oxygen species that are produced as a result of the ultraviolet sunlight. And we have made a separate video on sunscreens use. So I would recommend that you all check that video out in case you want to know the details about the sunscreen usage. There are some patients that prefer to use the vitamin C serum at night time, but many of the night creams that patients use do contain retinoids, and the vitamin C serum and the retinoids co-applied may cause a little bit of irritant effect. Although it is efficacious, but the patients may experience a little bit of irritation. So moving on to the next part of the discussion, the preparations of vitamin C. So the vitamin C exists in two forms. One is the active form and the other is the inactive form. The commercially available active form is known as the L-ascorbic acid. The best concentration at which the vitamin C acts is between 8 to 20%. So it is of paramount importance not to waste your money to get the 25% or the 30% or the 50% vitamin C, because it may double or triple your cost. The efficacy does not increase beyond the 20% concentration of the L-ascorbic acid. An important thing to remember is the molecule L-ascorbic acid is very unstable. So as soon as it comes in contact with the air, it gets oxidized. And this renders it useless. So it is very important when you are buying any preparation from the market, the bottle should be small, so that till the time the bottle finishes, you keep on opening the bottle, and till the time the bottle finishes, the molecule remains stable, the molecule remains active. Another point of consideration is for people who have a sensitive skin. So if you have a sensitive skin, the concentration that you should buy for the L-ascorbic acid vitamin C serum is about 8 to 10%. You should not go at any cost beyond the 10% concentration. The L-ascorbic form of vitamin C is not ideal for the patients who have an oily skin or an acne-prone skin. So coming now to the commercially available inactive forms of vitamin C preparations. The first one is the sodium ascorbyl phosphate, also known as SAP. It is as beneficial as the L-ascorbic acid available, and it also neutralizes the Propionibacterium acne, a bacteria that is responsible for acne pathogenesis, and it also reduces the oil and sebum production. Hence, if patients have an acne or oily skin, we would recommend that you buy the formulation known as sodium ascorbyl acid, also known as SAP. Moving on to the second commercially available inactive form of vitamin C, it's known as magnesium ascorbyl phosphate, also known as MAP. The biggest advantage of MAP is that it's a very stable molecule. So people who are fond of buying the big bottles to save on the money actually should choose MAP over the L-ascorbic acid form or the sodium ascorbyl phosphate form. Another advantage is that this MAP molecule is very good for the people with sensitive skin, so you can choose that. The downside is that it's not a very good antioxidant property molecule. So people who want a better efficacious result should ideally prefer the active form, which is known as the L-ascorbic acid, or the other inactive form, which is known as the sodium ascorbyl phosphate. So to summarize this discussion, I'll be actually taking up the question and answers that I get asked in the OPD, and that will help us view the questions that patients usually ask and the answers that we usually give them. So the first question that I get asked by patients are, what are the benefits of a vitamin C serum? The benefits are that it's an antioxidant molecule, an anti-aging, and it also improves the skin tone. Especially if you have a milder kind of a pigmentation on the face, it will benefit you more. The second question that I get asked is how to apply the vitamin C serum. So before using any new preparation on the face, it is recommended that you do a patch test behind the ear. So 48 hours before the actual application, you apply a little bit of the vitamin C serum and test for any allergic or irritant contact reactions. So if you happen to not develop any irritant allergic contact reactions, the actual way how you have to use it is you have to wash your face, rinse it with water, pat or dab it dry, and then take about 3 to 4 drops of the vitamin C serum and apply it evenly all over the face. And the recommended time that you should be using this is ideally in the morning time. So this can also help you with the sunlight induced free radical damage. Another question that I get asked by patients is whether we can combine it with a moisturizer or a sunscreen. The answer to that question is yes, you can combine it with a moisturizer, you can combine it with a sunscreen, but the ideal way to apply it is that you apply it on the face, wait for about 15-30 minutes and then put on a moisturizer, or then you can put on a sunscreen. An important point to remember is that the molecule itself is colorless. So the molecule, the preparation that you are applying, which comes in the bottle, is actually colorless. So if it changes color, turns brown or yellowish, that means that the molecule has become unstable, the molecule is inactive and renders the efficacy useless. So in case that happens, I know it's a pain in the heart because the bottle is very costly, but you have to discard it because you're just wasting your time in case the preparation loses its color. The next question that I get asked by patients is when I am going to see the results. The ideal time when you actually start feeling happy about your skin is between 3 to 4 months of time. So there are certain factors on which the efficacy depends on. If it's a young patient, it helps you more. The effects also depend on the compliance. So if you're using it regularly, you don't skip the doses. Every single day you make very sure religiously that you apply the molecule on the face. So you'll be a happy patient at the end of 3 to 4 months. Rather than a patient who applies it for 5 days, skips it for 10 days. Another factor is about the lifestyle changes that you can do. So if you happen to smoke, if you happen to consume alcohol, you can lessen that a bit, maybe stop it altogether. So the results are much more appreciable on the face. Next question that the patients ask us is, what effects will I see on the face? So the skin becomes extremely hydrated, the skin becomes soft, becomes very supple, light to touch, and it also evens out the skin tone. So if you have a milder kind of a pigmentation, like an uneven doubling of skin tone, that helps you a lot. But in case you have a disorder known as melasma, in which there is a deeper component to the pigmentation, you'll probably not be a happy patient at the end of the treatment period. And the most important and the all-important question that is asked by patients in the end is, does it really work? So the answer to the question that does vitamin C really work is a resounding yes. Most of the patients who use vitamin C are a happy lot at the end of the treatment period. I thank you all for watching the video patiently. I'm sure you would have learned a lot about vitamin C today. I hope we keep this discussion going ahead and keep learning as we go on in this journey together. I wish you a healthy time. God bless you all. Thank you.